Are nitrates in your drinking water quietly harming your health? Introduction. Most of us expect our drinking water to be clean and safe, but across the United States, especially in farming areas, there's growing concern that a hidden contaminant might be putting people at risk: nitrates. These chemicals, which often come from fertilizers and animal waste, have long been linked to a rare but serious baby illness called blue baby syndrome. Now, new research is showing that nitrates might also quietly raise our risk of cancer, even at levels that are currently considered safe. Let's break down what this really means, how it affects you and your family, and why the Environmental Protection Agency, EPA, is being called to take urgent action. What are nitrates and how do they get into water? Nitrates are chemicals that naturally exist in soil and water. But the problem starts when farming practices, like using chemical fertilizers or storing lots of manure, release too many nitrates into the environment. Rain can carry those excess nitrates into nearby rivers, lakes, and groundwater. That water often ends up in our taps. For decades, the government has said that water with nitrate levels under 10 milligrams per liter, is safe to drink. That rule was based on protecting babies from a rare condition where their blood can't carry enough oxygen, but it didn't take into account what nitrates might do over long periods of time to adults or anyone else. What does new science say? Researchers are now finding strong evidence that even low levels of nitrate exposure may increase the risk of certain types of cancer, especially colon, stomach, bladder, and kidney cancers. The body can turn nitrates into something called N-nitroso compounds. These are known to cause cancer in animals, and possibly in humans too. One study looked at 60 different scientific papers and found links between nitrate exposure and 17 types of cancer. Another study showed that cancer risk went up even when nitrate levels were below the current safe limit set by the EPA. What does this mean in plain terms? Even if your water meets the current safety standards, it might still be carrying levels of nitrates that can increase your risk of cancer over time. Where is this happening most? The biggest problem is in areas where farming is intense, places like Iowa, Minnesota, and Nebraska, where the land is used heavily for corn, soy, and livestock. These states have some of the highest nitrate levels in the country. People living there often rely on well water, which may not be treated or tested as often as city water. Why does this matter? If you live in a farming region or get your water from a private well, there's a higher chance your water could be affected, and you might not even know it unless you test it. A divide between public health and industry. While scientists are urging the EPA to tighten the rules, some industry groups are pushing back. They say it would be too expensive to upgrade water systems and that nitrates in food, like spinach or beets, can actually be healthy. Here's where it gets tricky. Yes, nitrates from vegetables can be good for blood flow and heart health, but that's because these plants also contain antioxidants that protect your body. Water, on the other hand, has no antioxidants, so nitrates in water don't come with those same protections. Bottom line, nitrates in veggies equals okay. Nitrates in water equals potentially risky, especially over time. Why is this so hard to change? This is not the first time we've seen something like this. In the past, industries pushed back on regulating lead, asbestos, PFAS chemicals, and cigarettes. Often, they funded studies to create doubt, even when the science was clear. That's what's happening now with nitrates. Groups like US Right to Know, a nonprofit that investigates industry influence on public health, are raising red flags. They say companies are using the same delay tactics, funding their own research to make it seem like there's no danger. Should you be worried? If you live in an area with farming or you use well water, it's worth looking into. You can get your water tested. Local health departments sometimes offer free testing, or you can order test kits online. If you live in a city, your water is probably tested regularly, but that doesn't mean the standards are up to date. What can you do now? Get your water tested, especially if it's from a well. Use a water filter certified to remove nitrates. Reverse osmosis is the most reliable. Stay informed and support policies that prioritize clean water. Conclusion: nitrate pollution is growing, but our water safety rules haven't changed in over 30 years. Meanwhile, science is showing that even small amounts of nitrates in our drinking water might carry serious long-term risks like cancer. Families deserve better protection. The EPA now faces a critical choice: listen to the science or continue to delay. This isn't just about data, it's about our health, our children, and the water we drink every single day.